Melissa Ramsey, how can you tell me what can I take to lower my sugar? It's always high 5 or 600. What can I do to lower it? Melissa, you're going to have to take some medication, possibly even insulin. You are, without question, a diabetic, and sugars that high can be dangerous. You have polyuria, which is urinating a lot. You have polydipsia, which is always thirsty, which means you probably can't sleep through the night without having to get up to urinate multiple times. But that dries you out, creates a dehydration circumstance, and can predispose you to a diabetic coma or diabetic ketoacidosis, which is life-threatening. That's a life-threatening state. So you need to get that down. Sometimes when you are glucose toxic, which you are, that means your sugar is too high, you have to utilize insulin to get it under control. Once you've broken or resolved the glucose toxicity, then you might be able to control your blood sugars with up to 3 medications. Now, they used to call it, triple therapy. 3 different medicines or oral medications to control your diabetes. If that doesn't do it, you have multiple injectables now. The GLP-1s, which would be the Mounjaro and the semaglutide, the Ozempic, are indicated for the treatment of diabetes, and they will lower your blood sugar. They will also make you lose weight. They will lower your A1C and get you under control. So it's very important you also don't get cheap sugar from things like sweet tea and sodas. Sodas are off your limits now, and no sweet tea ever under any circumstances. You can drink tea, just sweeten it artificially. But your beverage of choice needs to be water, and you need to drink lots of it. When you drink lots of water, you will flush the sugar out. You will urinate out the sugar, but you will also urinate out the calories associated with that sugar. So water is your beverage of choice. And then class of drugs, I would look at metformin is the first drug that you start on. The European model is 500 milligrams of metformin 3 times per day with your breakfast, with your lunch, and with your dinner. The American, they may give you 2,000 milligrams twice a day, or up to 4,000 in one dose in the evening, which always gives you diarrhea and nausea and vomiting. So the European model, much less dose, spread out on each meal, works very effectively. So you take the metformin. If you can tolerate it, please do. Then my next choice would be what's called an SGLT2 inhibitor. Those are drugs like Farxiga and Jardiance, or the name brands. They do something amazing. When your sugar is high, they make you urinate out the sugar. You also urinate out the calories associated with that sugar. So it literally makes you lose weight. And when your sugar is normal, it cuts itself off automatically. It's glucose dependent. So that means that when your sugar is high, it's on and working. When your sugar is normal or low, it stops working automatically. So you cannot get hypoglycemia or low blood sugar from this class of medications. It just doesn't happen. And then, of course, the GLP-1s, which are the Mounjaros and the Ozempics. So it's going to require a partnership with you and your provider to get you under control. It's probably going to take anywhere from 2 to 6 weeks to get your sugar stabilized. And that would mean what I do with my patients, I have them come in every week or no less than every 2 weeks, depending upon what I have them on, and then monitor them. It's not difficult to get the sugar back under control. What is difficult is not going back to bad habits and getting it back out of control again. So great question, Melissa. We appreciate you.